Hi, today I would like to demonstrate how to take care of otoplasty after the surgery has been done. It is very important to realize that all surgeries need aftercare, and many a time the surgery can go very well, but if an infection happens afterwards because of lack of proper care, then the whole result can be destroyed. So it is really imperative to learn how to take care of this. And what I found is, despite written instructions, sometimes it's very difficult to really communicate to patients how to exactly do it right. And I would like to demonstrate how to take care of an otoplasty patient. And we'll start first by taking the dressing down. The patient has had surgery yesterday and he did not need to do any care the first night because you're all wrapped up. But the next day, when the dressing comes down, you have to start cleaning the areas of incision, which in case of otoplasty are only behind the ear. And that's what we are going to demonstrate. The first step is to take the dressing down. This is the Velcro dressing that can be reapplied, and we'll put it back on after the wound care. It's important to use it for the first 48 hours. After that, you only need it for nighttime. And if it is uncomfortable or too bulky at night, then you can always use a soft headband just to make sure your ears don't flip forward. So we have taken off the old dressing. It was moist cotton, not moist with water, but basically bacitracin, just to contour and shape the ear. And we have removed that as well. Important point to note, please. As you can notice that I have gloves on, so if you're cleaning at home, it's best to have gloves. You can get it from any pharmacy. Or if you don't have gloves, make sure you wash your hands for at least a minute with a regular soap, and then start the cleaning process. So now, as you can see in the ear, I'm going to just flip it forward, but I do not want you to do that at home. So I'm just flipping it forward to show you that you can barely see anything right there, because the stitches are kind of pale in color, so you really can't see the stitches, but they're going down this way, and they're going a little this on the side as well. And it looks pretty clean. There's not a lot of blood or any caking or anything. So now the next step is the cleaning process, so that I'll demonstrate. For cleaning, you need either a cotton ball or you can use a gauze. Both are easily available on the pharmacy. And then you're going to use hydrogen peroxide. So you soak it really well. So you have to be generous with hydrogen peroxide. First, I'm just cleaning the general area, going all around in front of the ear, and as you can see, I'm being very gentle. Make sure you have a dirty shirt on or something, so if you make a big mess, that's okay, because you want to use lots of hydrogen peroxide. So as I'm cleaning in the back, I am not pushing forward the ear. I'm just going right around the periphery. I'm not even getting in the grooves yet. As you can see, I'm going around as well to clean up all of the areas. Sometimes there can be blood, so if you see blood, you will have to use a lot of hydrogen peroxide for the dried up blood to get it out. And even if you have to pour some peroxide there and clean it, that's okay. So after we are done with this, we are going to switch from a cotton ball or a piece of gauze to Q-tips, because Q-tips are easier to get in the groove there, and also the groove in front of the ear. So I have the Q-tips. I have soaked them in hydrogen peroxide, and now very gently I'm going in the front in the ear contours to clean them. Please do not go inside the ear canal. There's no reason to go in there unless you see some blood. You can clean it out, but don't go farther in. And sometimes it can take a long time to really get it all done. So once the front is done, then you go into the back and you're going to just slide it right there in the groove. So in this case, the patient really does not have any blood. I wish there was some so I can demonstrate how to keep working on it again and again with more peroxide, more Q-tips to get it all off, because you want to get to the point where there's no dried up blood left behind over there. Some surgeons use drains, so you might have a drain that the surgeon or the nurse is going to pull out right from behind. I don't have any drains, but I do have a hole here to allow for any egress of blood. Now that the ear is completely cleaned, we will apply some antibiotic ointment. It is going to be a choice of your own doctor what he or she prefers. Some might prefer only Vaseline, some might like bacitracin. So in the first few days, I am very liberal with the amount of ointment that I use. So I'm using a lot of ointment. This is bacitracin. Please remember that 16% people are allergic to Neosporin. And if you're using Neosporin and if you start seeing redness all around, it might not be infection, it might be sensitivity to Neosporin, which you can develop even if you had no problem in the past with Neosporin. And then you need to switch over to Vaseline or Aquifer. So I'm getting a lot of this right in the back. You don't need this much after the first 2-3 days, but in the first 2-3 days I think it's a good idea. And this is very easy because our patient is a male. In case of women or young girls, I tell them to just make like a high pony to keep the hair out of this area so you can clean it more effectively. In terms of showering, you can shower after the 48 hours. Great, so our cleaning is complete, and now all we have to do is put a little gauze, and after the gauze you put the wrap back on, and then you're good to go. A few of the things to remember: showering not for 48 hours. After 48 hours, no problem. Exercise not for 1 week. After 1 week you can exercise as long as you wear a headband so you don't accidentally hit your ear and move it forward. Same applies at night when you're sleeping, so having a headband to keep the ear pushed backwards. In terms of getting back to work, people have gone back to work as early as 3 to 4 days, because if you don't put a lot of ointment and you don't have a lot of bleeding, nobody can tell. And if you want to see, I have a video titled 6 days after otoplasty. So if you watch that video, you'll see that that lady looks perfectly normal. So you can go back to work as early as 3-4 days, that's no problem. But if you want to be idealistic, 1 week is a good time, because then during the day you don't need a lot of ointment. Heavy exercise, I would say wait for 3 weeks, because you can start a bleeding or something, so don't do it for 3 weeks. Travel after the first week, you can travel no problem by car, not by plane. Ideally wait for 2 weeks to travel by plane, because if you start bleeding in the plane, I won't be there to help you, or any of the doctors, so don't take a chance. In terms of any concerns, any issues, the only thing to watch at this stage is infection. There's really nothing else that can go wrong at this time. So if you have some drainage which is yellow in color, or you're getting fever, or everything is looking very red and hot, you must let your doctor know. And the most common reason for infection I have found is if you just touch your ear without washing your hands. So please be very careful. It takes just like one time rubbing your ears with dirty hands and infection can start. Otherwise, it's very simple, and always remember, if you have any concerns, don't try to guess, call your doctor and get the answers so you can take care of issues in time. Thank you. Thank you for watching the video. I hope you liked it. I love doing these videos and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also, we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.